Hello, my name is George Lee. I'm a family practitioner in Bellevue, and I'll be talking today about preventing colon cancer with a plant-based diet. The first slide is pretty self-explanatory. Diet may be linked to as many as 70 to 80% of cases of colorectal cancers. In some studies, it quotes up to 90%. If anyone has heard about the IARC, it's the International Agency for Research on Cancer, and they devised a system of categories to evaluate the carcinogenicity of an agent, of a certain food. And why did they come up with that? Well, this International Advisory Committee met in 2014, and they recommended red meat and processed meat as high priorities for evaluation. This recommendation was based on the epidemiological studies suggesting that increases in the risk of several cancers may be associated with high consumption of red meat and processed meat. So they came up with Group 1 as the highest, Group 2A, 2B, Group 3, and Group 4. And if you see this slide here, what do you consider red meat? Well, first of all, you got to define that. Red meat was referring to all mammalian muscle meat, including beef, veal, pork, lamb, mutton, and goat. What do you consider processed meat? The definition is processed meat refers to meat that has been transformed through salting, curing, fermentation, smoking, or other processes to enhance flavor or improve preservation. Most processed meats contain pork or beef, but processed meats may also contain other red meats or poultry. Some examples of that would be things like hot dogs and ham and sausages, corned beef, beef jerky even, and also canned meats. So if you look at that, it says in conjunction with the World Health Organization, processed meat was classified as carcinogenic to humans, Group 1, the highest level, based on strength of evidence in humans that the consumption of processed meat causes colorectal cancer. And surprisingly, the red meat was classified as probably carcinogenic to humans, Group 2A. And if you look at that, colon cancer strikes more than 1 million people annually and is responsible for more than 500,000 cancers deaths worldwide. Well, what are some of those epidemiological studies showing processed meat increased the risk of colon cancer by 58% per 100 grams of meat taken per day? Red meat increased the risk of colorectal adenoma by 27% per 100 grams consumed per day. What is N-nitrosyl compounds? Well, the N-nitrosyl compounds, referred to as NOCs, are found in processed meat and are formed endogenously when we take it in from intake of nitrite and nitrate. Endogenous nitrous compounds, once they form, it's antagonized by inhibitors in fruit and vegetables, especially vitamin C, and promoted by the heme in red meat. In this particular study by Hughes, a dose-dependent effect of dietary meat on endogenous colonic N-nitrosation. Back in 2001, human male volunteers were studied in a metabolic facility while they were fed randomized controlled diets. In 8 of these volunteers, there was a significant increase in fecal apparent of these total N-nitrosyl compounds and nitrite excretion. So what does that mean? Endogenous these nitrous compounds formation, they combine into the combination with prolonged transit time in the gut may explain the epidemiological associations between high meat, low fiber diets and this colorectal cancer risk. In this slide, there's some points there to mention. Vegetarians have a lower rate of risk factors for colon cancer. Point number 1, risk of being overweight or obese is 65% less for vegans and 46% less for vegetarians. 70 to 80% reduced risk of hyperinsulinemia, and a reduced risk of Crohn's disease by 70% in girls and 80% in boys. In the study 2004 by Setso, they did a study of vegetarian diet and antioxidants. Effects of a long-term vegetarian diet on biomarkers of antioxidant status and cardiovascular disease risk. The objective was this. They compared plasma biomarkers of antioxidant status, oxidative stress, inflammation, and the risk for coronary heart disease in long-term vegetarians and omnivores. And what does the results show? Well, a long-term vegetarian diet is associated with markedly higher fasting plasma, ascorbic acid concentrations, and lower concentrations of the high-sensitivity CRP, C-reactive protein. It's an inflammation marker. Long-term vegetarians have a better antioxidant status and a coronary heart disease risk profile than do apparently healthy omnivores. This shows in a Kazdaghli study done in 2014. Colon carcinogenesis, influence of Western diet-influenced obesity, and targeting stem cells using dietary bioactive compounds. When you look at the abstract, there was recent evidence that should suggest that the majority of the cancers, including colon cancer, were driven by cancer stem cells. Now, this is fairly new studies because we probably didn't hear much about these stem cells back 10, 20 years ago. Diet, they found, contributes to 20 to 42% of all human cancers and about 50 to 90% of colon cancer. This Western diet-induced obesity elevates systemic insulin-like growth factor 1 and insulin levels, and they were thinking that this could be what led to the elevated levels of this cancer stem cells. And because of that, dietary compounds such as grapeseed extract, curcumin, which is an extract of turmeric, lycopene, and resveratrol have promising chemoprotective effects. So we felt like maybe those are some of the newer research that's out there. Sulforaphane and colon cancer. As mentioned earlier by one of our speakers, levels of the glucoraphanin and sulforaphane are highest in broccoli. Sulforaphane has antioxidant, antimicrobial, anti-cancer, anti-inflammatory, anti-aging, neuroprotective, and anti-diabetic properties. The sulforaphane also protects against cardiovascular and neurodegenerative diseases. You can find these, obviously, as mentioned before, in the cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. I kind of mentioned earlier in earlier talk today that children should be made to eat those. So keep at it, parents. Benefits of phytic acid. As mentioned, it modulates genetic damage, inhibits tumor growth and progression, inhibits metastasis. Since phytic acid can only be obtained from plant foods, guess what? Vegetarians and especially vegans, they will benefit from that over the meat eaters. In this study, the World Cancer Research Fund American Institute for Cancer Research panel upgraded the association between fiber and colorectal cancer to be what? Convincing. And I mentioned earlier today too, when a research institution like that mentions convincing, it should be, I think, pretty convincing. In the study of Sengupta, does butyrate protect from colorectal cancer? There was an abstract that says the butyrate, the 4-carbon fatty acid, is formed in the human colon by bacterial fermentation of carbohydrates, including dietary fiber, and it suppresses this colorectal cancer. The butyrate has a diverse and apparently paradoxical effect on cellular proliferation, apoptosis, and differentiation. There appears to be some evidence that delivery to a specific area of this butyrate to the proper site can actually help with early tumorigenic event. Another observation was that the deoxycholic acid, a secondary bile acid, has been shown to kind of damage DNA, which then of course would lend to maybe carcinogenic tendencies. Having a vegetarian diet obviously significantly lowers that level of deoxycholic acid than the usual typical American diet with a lot of proteins and meat. So that's another good point to be noted. As far as recurrence, there was a study done by Yunju in 2013. And this particular study talked about the dietary patterns and colorectal cancer recurrence and survival. It was a cohort study, and the objective was to determine or to examine the association between dietary patterns and the colorectal cancer survival. So what they did was they went to the familial colorectal cancer registry in Newfoundland, and they gathered about 529 newly diagnosed colorectal cancer patients from Newfoundland, and they found them from 1999 to 2010. And let me make a correction. They found them from 1999 to 2003, and they followed them to 2010. And the results were this. Disease-free survival among the colorectal cancer patients was significantly worsened among patients with a high-processed meat dietary pattern, meaning that if those who ate a high-processed meat diet, they actually would not survive, and they had a recurrence of cancer. The conclusion also was that the processed meat dietary pattern prior to diagnosis is associated with a higher risk of tumor recurrence, metastasis, and death among the patients with the colorectal cancer. So having had that diet before and also continue it would cause recurrence. Consumption of high amounts of the beans, reduction of risk 65%. Peas and greens 45%, nuts 42%. In my last slide, it's interesting to note that as a primary care physician, I'm always recommending my patients to get their colonoscopies, right, at age 50, women or men. Unfortunately, that colonoscopy only provides a secondary prevention. Why not, based on the evidence that's been shown today as from this lecture as well as all the other lectures, a plant-based diet is a method of primary prevention for colon cancer. And you can start that from very young. You don't have to wait till age 50. Have a good day.